President Yoweri Kaguta Museveni directed the Minister of Health to procure a total of 42,000 specialized beds to be installed in all government hospitals across the country as an immediate response to the demand of COVID-19 pressure exerted on the sector.
I told these people, as a strategy, assume we reach the danger point of Italy, 42,000. How far have you gone now?
We have submitted a budget, Your Excellency, to finance.
No. How far have you gone now to
expanding the bed capacity?
Yes.
We are now we are trying to establish more beds, at least 60 at regional referral hospital.
How many beds do you have total? Never mind total. Because I told you 42,000.
We have about 3,000 beds.
Now you can see. That's why they didn't listen to my. So that's what the problem is.
This commitment to the people of Uganda was made last year. However, it has remained a partial fulfillment on paper to date. The ministry is reproving conditions attached to the directive which tied their hands while fulfilling the target.
The problem has been with resources to ensure that the beds are available, and also materials to manufacture the beds in country.
The cumbersome procurement laws failed the procurement and the full-scale response of the sector to the pandemic. The Health Minister, Dr. Ruth Aceng, files fault in the terms and conditions that were given by the President, limiting them to only domestic manufacturers.
The directive was to follow Buy Uganda, Build Uganda. So the manufacturers had a bit of a delay because of securing the raw materials, which had to come in from abroad, and they have been advised to use our raw materials here.
According to official ministry records, Ministry of Health signed 3 contracts with joint medical stores worth 1.3 billion Uganda shillings to supply 1,000 beds and mattresses, 2,000 blankets, and 2,000 bed sheets. In the delivery, notices of joint medical stores and acknowledgement receipts, the Ministry of Health categorically admits having received a total of 1,000 beds, 1,000 mattresses, and 1,000 blankets, and were delivered to Namboli National Stadium.
So far, they have been releasing beds to the Ministry of Health in small bits. Before this wave, we got 1,300 beds. Another 4,600 beds is on the way, and another 10,000 is being manufactured.
Out of which 700 beds were fixed in Mandela Auxiliary Treatment Center, while 300 were relocated to Mulago National Referral Hospital and are being utilized by COVID-19 patients. However, the scarcity of specialized ICU beds in government hospitals has caused havoc on the sector when it comes to offering basic treatment to COVID-19 patients. This has led to exorbitant charges by private players in the health sector who have the facilities required to save lives of COVID-19 patients.
The bulk of the cylinders are coming from outside, and this is not in our control to get them here in time. And also, we realized that many of these facilities, the private facilities, would take some of these cylinders and take them in the private. We realized actually a number of our cylinders were in the private sector, and we've been trying to get all of them.
According to the official Twitter handle of Ministry of Health, an assessment was conducted at the tail and end of last year about intensive care units in all hospitals in the country. However, only 143 ICU beds, complete with ventilators, patient monitors, and high-flow oxygen therapy apparatuses, were procured and distributed to various facilities.
We have already started that process of acquiring more cylinders, and this our target is 15 to 25,000.
Due to the COVID-19 pandemic, the Ugandan health sector is overwhelmed by the patients, especially those in need of the specialized beds. Before the pandemic, Uganda had a total of 14,000 beds, which does not reach even a quarter of 42,000 beds commitment. Nasil Lubwama, UBC News.